Gicqueau. I'm the president and CEO of Clinovo. So Clinovo is a CRO with a technology edge. We provide biometric services, e-clinical solutions, and staffing solutions. And we're currently mostly focused on California customers.
And what SaaS technologies do you use a lot in your clinical solutions?
I mean, in terms of SaaS, of course, we have clinical and statistical programmers, so mostly base SaaS. But we also use SaaS intranet. We've built some web system using SaaS intranet technologies, whether it's for data management systems, CDISC conversion, and project management tool. As an example, our time entry system, invoicing system was built internally, leveraging SaaS intranet technologies.
Great. Is Clinovo more of a technology solution provider or a resourcing placement organization?
That's a very good question. So really we have three main divisions in our company. So the staffing agency is one. Then we have biometric services, EDC data management, biostats. And then we have a third division headed by Marc Degouzier with 30 years IT experience, where we are system integrators for clinical systems. So we provide CTMS systems, we support 5 different EDC platforms, one of them is open source, in fact, and we've done the validation ourselves. Regulatory systems as well. So we have about 12 different systems that we can implement for our customers. So these three divisions are completely complementary, in fact.
So out of those three, which one would you say is your core DNA of what you do, and which one generates like the most revenue in your organization?
And again, you know, what's happened in the past is not what will happen in the future. So really staffing, I would say, is our bread and butter today. Biometrics is really starting to bloom. But really what I believe is the most potential for us is the IT division. Because it's not only integrating clinical system for our customers, but we are starting providing IT services as well for the clinical space. So I think for now, staffing is number one, biometrics 2, and e-clinical 3, but talk to me in 4 years and you will see that IT is number 1, number 2 will be biometric, and staffing number 3.
In terms of the IT and technical solutions, do you also explore and use open source technologies as compared to a SaaS solution?
Definitely. I mean, so we are although software developer, we build our own systems. We're a big fan of the LAMP system, like PHP, MySQL. On the EDC, as I mentioned, we use OpenClinica following the LGPL license, and we added some feature and validated it. And something else we've even done in the SaaS community, whereas SaaS is not famous for being open source, but we build a package to easily map any clinical database to SDTM. I mean, it's about 5,000 lines of code. We've been using it internally for 5 years, but we decided to give that package free to the SaaS community. And we've got just above 300 downloads over the last few months. So I think for small companies, open source provides huge opportunity because it allows small companies with small marketing budget to have a very high visibility.
What do you think standards such as the CDISC and its various data models like SDTM, how does that affect your work and maybe all your clients' work?
I mean, these standards are very critical to increase the efficiencies of running clinical trials. But for true adoption of a standard like CDISC, you need to have tools that support the standards. And when a tool is free, it's much better even for adoption. So that's our goal, is really to promote that this standard go widespread, providing free technologies to the SaaS user community to leverage these standards.
I hear that you're presenting today too at WUSS. What paper are you presenting today and other things that you've been doing at WUSS?
Yes, I came here with my team. Together it's 3 papers and 3 posters that we're presenting. And right now I'm going to present CDISC Express, which is our open source package to map any database to SDTM.
Great. All right, thanks a lot.
Okay, thank you, Sai.